Okay, here we're getting ready to get started. This is Robin. She's going to have her cheeks and her lips injected. Robin, what are you hoping for the injections to do?
I'm hoping for my lips to be a little fuller, but not too big, and my cheeks to look a little more youthful. This is not my first time getting my lips and my cheeks injected. I loved it so much that I'm doing it again.
Getting excited?
So excited!
Hi, so we're getting ready to get started. Here's Sharon. She's the nurse injector.
All right, so we are gonna do Robin's cheeks and a little bit in her lips today. Robin has had previous injections. We probably did your cheeks about a year ago, maybe a little less than that. So we're gonna use Restylane Lift in her cheek area, and we're gonna use Restylane in her lips. So very important prior to injection with any type of filler is cleansing the skin appropriately. So Robin has already washed her face. We've numbed with topical numbing medication. The products itself have numbing medicine in them. So now I'm just going to wipe again. You can never be too clean with alcohol. And you'll see me throughout the injections just constantly wiping the skin. Filler is considered an implant, so putting it in clean conditions is extremely important. Okay, with Robin, we are going to augment the size of her cheek. You can see with normal facial aging, you start to flatten in this area, and then she has a pretty cheekbone already, but we're just going to accentuate that. You can see initially I do a series of serial punctures and then a little bit of fanning. So we're kind of accentuating what she already has, which is the cheekbone.
Robin, how you feeling?
Awesome.
How's the numbing medicine?
Perfect.
And cheeks of all areas on the face, I think it's pretty painless. Maybe a slight pinch. And lots of molding just to make sure the filler is nice and smooth and where we'd like it to be.
So Sharon, what are the key features and best techniques to get the best results?
So with filler in the cheeks, breaking the cheek into two areas, the medial cheek and then the lateral cheek, placing the filler where they need it the most is very important. So Robin flattens in this area a little bit. So the majority of her filler is going to go right in the apple of the cheek, and then that little bit that's going to be placed on the cheekbone is going to really just accentuate what she already has. So in the medial cheek area, I work more superficial and fan the product to get even distribution along the apple of the cheek. And that minimizes the number of injection spots as well by fanning. As I move out laterally, I'm going to do more of a serial puncture. And you'll see with the serial puncture, it just lifts the skin and gives you that nice fullness and less injury to the tissue with the puncture.
How you doing, Robin?
Great.
A little bit pain on a scale of 1 to 10?
1.
Wow, that's great.
And during the whole process, it's important to constantly mold the filler in the skin to give you a nice, smooth, even distribution. So lots of pushing and molding. So we're going to add a little bit of volume to both Robin's top and bottom lip. She's had her lips done before. You can see she's got a really nice definition. So we're going to work to add a little bit more volume in the pink area of the lip.
With lip injections, I think it's important to start off with small and natural amounts. Fake lips come from injecting too much product. Sharon is fanning the medicine or the product into the lips to give a smooth, even distribution and a natural result.
Okay,
close the lips.
How you doing, Robin?
Excellent.
This hurts a little bit more than the cheeks, doesn't it?
Tiny bit.
On a scale of 1 to 10?
3.
The medicine is mixed with lidocaine, so it numbs as the process goes on.
After injections are finished, I just take a little bit of antibiotic ointment and just massage the areas that were injected. Again, just reassuring that there's no lumps, bumps, or uneven distribution of product.
Robin, look into the camera.
Swelling lasts about 48 to 72 hours.